lecture to these students on how to obtain an arterial blood gas and to how to interpret those results. It's just a basic lecture on how to get started on arterial blood gases, or I might say ABGs. It's the same thing as arterial blood gases. What you have in front of you right now is a packet of information that I've made for my learning plan. And with any lecture or training program that you have, you need learning objectives in order to know what route you're going in this lecture. So on the first page you see that I have, after completion of this learning plan, the student with 100% accuracy will be able to identify the indications, the contraindications, and hazards of an arterial blood gas. They will also be able to properly obtain an arterial blood gas sample, and they will also be able to interpret the arterial blood gas sample results, because there's no sense in drawing a blood gas if you don't know how to actually read the blood gas and help your patient out. Okay. The next handout we have is actually what you need to do an arterial blood gas. And here I have with me today the actual contents of a blood gas kit. You will need a needle, which is like a TB syringe, and with a needle on it, of course. And you also need, you have to have a stopper to put your needle in, a little cone, like this. Then when you get done, you will need a stopper, because the needle will come off, and you'll have a stopper to put on it. You will also need a specimen bag to put your specimen in. You will need an alcohol pad. A 2x2 gauze is also in there. A Band-Aid or tape you can use, depending on sometimes the patient has a preference, what they want to use. And then a patient label, which needs to go around your blood gas sample, so you'll know you're running the sample on the right patient. And then you'll actually need the actual physician's order to tell you whether it needs to be on room air, whether you need to draw it with any O2. So those are the things that you need for an arterial blood gas kit. Any questions so far? Does everybody understand? Okay. So the next thing we're going to do is I'm going to show you a YouTube video up here on the screen of the actual procedure of how we need to do this arterial blood gas. So give me just a few minutes, we'll get it started. Takes a minute to warm up. Okay. Everybody see that okay? Okay. No sound. Hang on. Turn it up just a little bit. Does anybody know what doesn't have any sound?
Move the bar, like the volume bar next to it.
Locate the artery and palpate.
Sorry, I see that now. Okay.
This is an instructional video about how to perform an arterial puncture. When sampling, be sure to always follow your hospital's procedures. Before sampling, confirm the patient's identity. If a recent change in the oxygen flow rate has been made, wait approximately 20 to 30 minutes before sampling. Locate the artery and palpate it for a strong pulse. If recommended by your hospital's procedures, you can perform the Allen's test. Clean the puncture site with an alcohol swab. For self-filling syringes, preset the plunger to the recommended volume. Hold the needle bevel at a 45-degree angle or less to minimize trauma to the artery and puncture the skin and arterial wall. Hold this position until you have collected the desired blood volume. Withdraw the needle and apply pressure puncture to the puncture site. Remove the needle using a safety device. Gently tap the syringe so that air bubbles are forced to the top. Expel air bubbles through the tip cap or into a gauze. Mix the sample thoroughly to dissolve the heparin. Label the syringe with patient ID and immediately transport the sample to the blood gas analyzer.
Okay. Okay, so in this YouTube video, they described how to actually do the arterial blood gas stick, as you see in the video. Now, the first thing that you need to do before doing a blood gas is check for collateral blood circulation. So, Cindy, would you come up here and you can be my patient here. I'm going to show you all how to do it, then you need to partner up and show them how to do this. Okay, your radial artery is your place of preference, is site preference to stick. So your radial artery is right here. Your ulnar artery is on the opposite side. So what you need to do is you need to occlude, you need to palpate for each one. Once you feel that, you need to ask her to squeeze your hand back and forth 2 or 3 times. One more time. And then you let go of the ulnar artery when you open. And the hand should pink up within 5 to 15 seconds. But you keep the radial artery occluded and unocclude the ulnar artery, and it should blanch up. I mean, it would be blanched, and then it would pink up. Thank you. Then, if that one doesn't work, it doesn't pink up in 5 to 15 seconds, you need to choose another extremity. So at this time, if y'all don't care to partner up and just practice that, and it's called a modified Allen's test. Feel both pulses. She pink up? Okay. Okay, you can do Molly. Y'all doing okay? Good? Yeah, okay. So everybody's got a good blood flow?
We do.
Okay, so therefore you can stick that site, but if they do not pink up, then there's no collateral circulation. You need to stick another site. Okay? All right, so after that, next you have in your packet are actual clinical practice guidelines that I have pulled from the AARC clinical practice guidelines for arterial blood gas sampling and then the actual analysis of both of those. The AARC stands for American Association of Respiratory Care, and they maintain all of our protocols and our guidelines for each skill that we do in respiratory care. So I've pulled these indications and contraindications from those guidelines. The first one we have is arterial blood gas sampling. The indications that you see, the first one is the need to evaluate the adequacy of ventilatory acid-base and oxygenation status. So you just need to know you won't know their acid-base balance unless you draw blood on them, okay? The next one is the need to verify the patient's response to therapeutic intervention and or diagnostic evaluations. So you would, when you draw blood gas, it would indicate what therapeutic intervention you need to do for that. And the last one is the need to monitor the severity and progression of disease processes. For instance, you would know whether your patient is crashing or not, depending on what their blood gas results are. So those are the indications for the actual arterial blood gas sampling. Of course, there's always contraindications when you have indications. So the contraindications is the modified Allen's test that we just did. If you have a negative result, that's a contraindication. And like I said, you need to choose another extremity. And then the second one is arterial puncture should not be performed through a lesion or distal to a surgical shunt. Does everybody understand what that is? For instance, what would you not want to stick? What kind of place? What if they're a renal patient? What do you not want to stick? Anybody? What might they have? A shunt? Okay. They might have a shunt in the right arm. So you need to go to the other side.